good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor for the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites on our monthly edition of my favorite, Show Me the Science. Yeah, that's what I'm talking about. All right, a thunderstorm brings heavy rain and winds. Something to be aware of, but not necessarily an emergency for most people. But for people with asthma, yes, asthma, it can create a medical emergency. We ask people their thoughts if they believe the weather can really trigger asthma symptoms.
It's hard to say, if what the difference between, the correlation of asthma and thunderstorms. It's hard to say what exactly in the thunderstorm is causing, but yet the pollen, the air pressure, there's a bunch of different things that could be causing it. But yeah, that's exciting to know.
Spring allergies were difficult, and I remember particularly when it was raining or damp was also a difficult time for me.
No, I'm not so sure about the weather, but I do know like seasonal my allergies will, like sometimes during the summer or early spring, they may flare up.
I mean, it seems like when it's about to rain, they get worse because I don't know if the pollen kicks up or what, but I mean, they're just bad all spring and fall.
I would love for people to better understand, when emergencies like that can happen, because asthma can be really deadly, and even if it's not deadly, just uncomfortable and painful.
Deadly and uncomfortable. Well, that sounds pretty accurate. And now we have the science. Let's take a look. As recognized by the World Allergy Organization, showing thunderstorms are linked to spikes in asthma-related emergency department visits. We know the research from Kansas surrounding thunderstorm asthma and how families can use this to help prevent an emergency. To help explain this phenomenon, please welcome one of the study's authors, allergist and immunologist, Dr. Selena Geer. It took me 30 years to say that right. Also joining us is resident physician at KU Wichita Center for Healthcare, Dr. Diala Merhab. Did I say, which one is it? Merhab. Okay, I got it there. Finally, okay. Joining us virtually is Justin Floor and his 10-year-old son, Jeremiah. Guys, it is great to have you both with us. Thank you for being on the program today. Justin, when was the first time you realized that thunderstorms seemed to trigger your asthma or Jeremiah's symptoms?
I think growing up, whenever I was out in sports practices in high school and college, I kind of didn't really I didn't think about the correlation of it until I got a lot older and was just being more self-aware of what was going on with my body and how it was reacting to different situations especially with weather changes. I think it was a little hard for us to kind of get acclimated to any type of activities. I grew up always just thinking it was just some type of sports asthma that I had. So whenever my heart rate kind of got bigger or got higher, it was more of just that kind of asthma. But now looking into it, just seeing that I'm starting to see that my performance and just my overall daily activities have been affected, specifically with thunderstorms coming. So whenever I think that I have my allergies controlled throughout the season changes, here comes a thunderstorm, and then I'm kind of back to square one all over again, and I have to try to reacclimate for a couple days while that happens. With that kind of self-awareness, I also see that with Jeremiah too. Throughout any of the stormy days, he'll be fine one day with just being a normal kid. The next thing you know, as the storm's coming up or the day of a storm, he's either starting to have some issues with his breathing or even start rashing up a little bit. And so whenever we started seeing our specialists, we started to see a commonality of the reactions whenever these storms are coming.
Jeremiah, when you hear thunder or see lightning, how does your body feel? And can you describe what happens with your breathing?
So it becomes to get very heavy and
Makes it hard to breathe.
Yeah, and it's hard to breathe a lot.
So you don't like thunderstorms so much, I'm guessing.
Yes.
Wow, that's tough because I kind of like thunderstorms, but next time I have a thunderstorm around me, I'm going to be thinking about you and saying, I wonder if Jeremiah's doing okay with his breathing right now. Dr.
Yeah,
Keeler,
we like the sound of
this research looked at asthma-related emergency visits across Wichita. Before we get into the data, can you tell us what happens during a thunderstorm that could trigger or worsen asthma?
Yeah, exactly. So this family is describing what we know is a thunderstorm-related asthma exacerbation. This is due to a complex interaction of environmental factors and can really affect patients who have allergies and asthma. These events occur when high concentration of airborne allergens, most commonly grass and mold spores, are concentrated at that ground level because of the thunderstorm. Humidity and direct damage to the grass pollen from falling rain can actually shatter those pollen and mold spores and make them smaller. Those smaller particles can reach the lower airways, and in patients who are sensitive with allergies and asthma, it can cause inflammation that drives that potentially severe asthma attack. Why it occurs in some years and not others is not well understood. It may be a cycle of humidity and wetting and drying of the grasses, along with the wind disturbances, as those aerosolize into the air and are inhaled in those patients who are sensitive. We know our area is prime for pollen and prime for thunderstorms.
I bet. What about all that grass down the Flint Hills when that wind comes through?
That's exactly what's driving this. There's so much grass, pasture grass alongside freeways. These are the grasses that really put out pollen, really April through June or July, and really exacerbate asthma.
So in the words of the song, when the wind comes sweeping down the plains, and it goes to aerosols and all that. And really what we should be saying, and you start to wheeze.
Yes, so unfortunately, Wichita is one of the highest pollen areas, one of the highest allergy suffer areas in the entire United States.
Oh, that's tough. Okay, well, let's look at the data. Researchers analyzed nearly 4,500 asthma-related ED visits across three Wichita, Kansas hospitals from January 2020 to December of 24. Meteorological records showed 38 thunderstorms during that period. The average number of asthma visits was nearly 18% per day during thunderstorms compared to 3 visits on non-storms days. That's 6 times more visits on storm days. Okay, that impressed me a little bit. I'm just saying. That is not. That's a big increase. The World Allergy Organization acknowledges that thunderstorms are a risk factor for asthma attacks in patients who have pollen allergies. And scientifically, why are pollen and airborne particles dangerous to the lungs?
So again, if those particles, specifically if they're smaller because of the effect of this thunderstorm, they can get deeper into those airways and cause more inflammation. And this happens in patients who have allergies specifically to grass or mold.
Yeah. Well, and we know that the smaller the particle, and depending on lots of other things around how it's charged and things, it can go pretty far into the airway. The real problem is when you get down to those really small terminal airways, and then you kind of activate that whole inflammatory response.
Exactly.
And all of a sudden, it's kind of like having to have your nose, you sneeze constantly while your lungs are wheezing. They're not sneezing.
Right.
Hey,
cough, chest tightness, shortness of breath. That was a good one.
That was not bad. All right, Dr. Murab, when you were working on this, what kind of data are you actually analyzing? What does it look like? And tell us a little bit about the story of what you discovered here. What you found?
Yeah, so we did conduct a retrospective observation and analysis, and we did obtain IRB approval for that. So what we did is basically we had all the asthma-related visits. We did a retrospective analysis of asthma-related emergency department visits across 3 major Wichita hospitals between 2020 and 2024. And we analyzed how many patients were coming to the emergency departments during this time. What we did essentially is we had to go back to the National Centers for Environmental Information to get the storm days. And after we were able to identify those storm days, we identified every calendar day in our analysis as a storm day versus a non-storm day. And then we did a daily counts of patients who presented to the emergency department during these dates. And we had a daily count, and we were able to have 2 groups, the storm days versus the non-storm days, and we compared the 2 groups. So that was through the 3 major hospitals in Wichita across a 5-year analysis period. And the way we were able to identify the asthma-related visits is through the ICD-10 codes. And for each encounter, we were able to get the age, gender, zip code, and ED disposition. So we had almost like more than 4,400 emergency department visits during this time. And among those, we had 627 that occurred on storm days. So that's like 14% of all asthma-related visits.
Storm days. That's crazy. Severe thunderstorm warnings have a whole new meaning to me now, and I'm a lung doctor. I hadn't really thought about the gravity of that. So, Justin, when you hear researchers warning thunderstorms can cause sharp increases in asthma-related emergency department visits, how does it change how you and your son go about your day?
I think we just need to make sure that we're really prepared for it. So I just need to, I stay alert on the weather. So if I see that there's a storm coming, I need to make sure that I'm taking my albuterol as kind of my rescue inhaler. That gives me that extra boost for my immune system and for my lung capacity, so I can actually kind of enjoy my day instead of kind of dread it. And that's the same thing we do, Jeremiah. We'll, whenever a storm's coming, we'll make sure that we're taking our precautions, making sure we're taking our allergy meds, and then an extra puff of our albuterol inhalers so to get through that day.
Pretty good advice. Now, Jeremiah, do thunderstorms make you feel scared or anxious because of asthma?
Anxious.
Anxious? I bet it does. You have trouble breathing like that when those storm clouds rise and the wind kicks up?
Yeah.
Yeah, that's tough. Now, Justin, what do you do to help Jeremiah? You mentioned the medications and the albuterol. Do you guys kind of stay inside and try and avoid the outdoors?
Unfortunately, we do, as much as we like being outside, but I think staying inside really just helps, prevent a lot of any potential reaction that we have. Just because our reactions kind of get out of control based off on the storm. I can't really control what our reaction is going to be that day. So if it's going to be a normal day for us during a storm, or if it's going to be a heavy breathing day, or even like a hive or rash breakout day. It's so unpredictable. It's been kind of hard to see like what we're going to be doing that day. But I would say we would usually try to stay indoors whenever it does kind of storm outside, but we definitely would still stay active inside the house if we do.
That sounds like some pretty good fatherly advice, I think. Dr. Murham, what stood out the most to you when you were looking at the visit numbers? Was it the volume, the timing of the demographic, or the demographic of the patients who are coming in?
I think the volume and the concentration were the most striking. So storm days accounted for a small number of days in our study, but they had the most number of asthma-related ED visits, so that's a disproportionate, large number. And demographically speaking, I think age showed the modest association. So like older people were more likely to present on storm days.
Okay.
Yeah, but
people like me, I got you.
But a zip code and the ED disposition were not associated and did not have any statistical significance in our study. So I think the environmental factor showed a good association and was the most dominant driver.
Okay. Now, Dr. Gear, this study found spikes of visits during storms in an area not known for extreme pollen. So why is this such a big finding for patients? Although I would have said Wichita is known for pollen.
Yeah, Wichita is known for pollen, but so is this entire area. So pollen can blow for hundreds of miles. So the fact that the zip code didn't make a difference is not surprising,
picking it right up,
because
right?
storms blow that pollen for
Yeah.
miles and miles, maybe hundreds of miles even.
So does a storm in the fall or like August when things are hot and dry and dying versus the spring when everything, does that make a difference?
It would for grass pollen in particular, because it's not as prominent in that time of the year, whereas in the fall we have more weed pollen.
Okay, so what you're saying is that's a good theory but bad idea, because it does it's not true. All right, we are here to answer your questions. Send them in using the info on your screen. That includes the chat on YouTube or on Facebook or emailing the Medical News Network. Let's check in with Doc Hawk. All right, Hawk. You're good. That is still a good graphic. I'm still impressed when the wings move every single time.
Job.
They always
Yeah,
work.
That's
yeah,
awesome.
That's good. All right. No, well, so unfortunately, we're our first confirmed case of measles in Kansas City. First one since 2018.
Yeah.
Tell us a little bit about the overall trend this year. What should we be concerned about with this case, and what should we do? Although I think you and I both know the answer to this question.
Yeah, absolutely. So again, as a reminder, this was a statement that was put out by the Missouri Health Department and the Kansas City, Missouri Health Department. Just as you stated, and we talked about this earlier, we knew that last year there were cases in Kansas. There was a Southwest Kansas outbreak. Again, this was a Kansas City, Missouri resident. What we know is that this is an unvaccinated adult, and this is, again, according to the Kansas City, Missouri Health Department and Missouri Department of Health. So unfortunately, we do continue to see cases of measles rise in the United States. There are a number of outbreaks going on, particularly in South Carolina. We know they are almost up to 1,000 cases in their outbreak that has been going on since late last year. Within the past week in the United States, we reached 1,136 cases so far for 2026. And we know that if that pace continues for these first couple months, we know that we will exceed last year's total of 2281 or 2,281 by sometime this spring. So we are really set to surpass that, unfortunately. And with that, we also believe that United States will lose the distinction of measles elimination status, which we have held since 2001. What does that mean? It means that now the United States has continued sustained transmission of measles virus in the communities. And also, we know that also goes to the fact that we know that in general, for the last 20 years, we know and understand that the vast majority of measles cases in the United States were travel related. But now with new information, of the current 1,136 cases, only 6 of them are really being designated as travel related. So, and to put that into perspective as well as to why is there so much transmission, we know and understand that currently only 4% of the patients with measles are fully vaccinated. That means that the vast majority, in fact 92% or more, are unvaccinated or unknown vaccination status. As well, we also know that this is not a benign disease and you can suffer serious consequences. So far, the hospitalization rate is about 5% for measles. Measles cases in 2026, we know that in 2025 it was about an 11% hospitalization rate. And thankfully, there have been no deaths this year. But we know that as we start seeing increased cases, in general, you start to see 1 to 3 deaths per 1,000 cases. So again, not a benign disease.
And just to say it, there are a lot of challenges for measles, especially with children. People worry about getting vaccinated. I still don't know why we've given billions of measles vaccine with great safety records and lots of disease prevention.
Yeah.
But man, damage to sexual organs, damage to your brain, damage to your eyes. I mean, this is not a benign infection.
Yeah, you're absolutely right. We know that it can affect. So we know that 5 to 6 to 10% of people can get a pneumonia, can go to the hospital. And with that pneumonia, it can be due to the measles virus or a secondary bacterial infection. Just like you said, it can attack the brain, so you can get encephalitis, but also you can have continued effects of hearing loss and things of that nature. And in fact, when it does infect the brain, we know that there is an entity or a disease process that occurs 5 to 10 years after the original infection, which is fatal, and it's called SSPE, subacute sclerosing panencephalitis. There is no treatment for it, but it is because you have a recurrence now of this measles virus that has entered your body, and again, that can occur 5 to 10 years later. So obviously we know that it is not a benign disease. Those are the complications. What are the symptoms of acute illness? Well, high fever is one of them. So high fever can go up to 104 degrees. We also say the 3 C's with cough, coryza, and conjunctivitis, so it's runny nose, watery eyes, as well as a cough. And then, of course, several days after those symptoms start, those initial symptoms, you can have the rash. And that occurs typically about 4 days, maybe up to 5 days after the start of those initial symptoms. But those initial symptoms, it just seems like a regular cough or cold, which somebody may get. You are, unfortunately, infectious from 4 days before that rash starts until 4 days after. So you can spread it to people when you don't even know you're necessarily sick or you necessarily know that you have measles. And because of that, that measles virus, when you go through a space, whether that's the grocery store or you're at a party or you're at church, wherever you may be, that measles virus can hang in the air for up to 2 hours. So somebody can walk through that space an hour later. If they are not immune, meaning they haven't had their full vaccination series or born before 1957, and those are the two key components of who is immune, you can get infected with that and then obviously get the disease and have a risk for those complications.
So this is a difficult disease, and you mentioned some of the things around it. Now, about 1 in 4 people who get measles will be hospitalized. That's pretty bad, man. That's a lot.
You know, I think that is. So again, anytime you go to the hospital, you're obviously ill. You are at risk of other complications. So again, we talked about also, and here we have this graphic about that. 1 in 4 can be hospitalized. 1 out of 1,000 can have the brain swelling or the encephalitis that occurs. We also know there's other things that we had talked about with deafness. We know that you can get pneumonia, either viral or secondary bacterial. We also know that the virus does attack your immune cells, so you have some level of immunosuppression for the next 2 to 3 years as your immune system reconstitutes. And then also, unfortunately, we know that 1 to 3 out of every 1,000 people who get measles will die. There is no treatment for this virus. We know that for influenza, we have different antivirals. We know that for COVID, we have different antivirals. There is no antiviral treatment for this. Treatment is supportive. And again, the best way to prevent this disease is to get vaccinated. The vast majority of people, as we've talked about, who have gotten the disease are unvaccinated. The protection rate of the vaccine is about 97%. Again, vaccines do not protect you from infection. What they do protect you from is the disease and the serious consequences of those disease. And in fact, Dr. Jay Bhattacharya, the leader of the CDC, or the head of the CDC, yesterday just posted a video and basically said, measles is preventable and vaccination remains the most effective way to protect yourself and those around you. I know that we would second that and totally endorse that as well. Please understand your vaccination status for you and your loved ones, especially your children. If you are unvaccinated, there still is time to go get a vaccination, at least 1 dose. For children, we know that vaccination starts at 12 months. But in the case of these outbreaks that are currently going on in communities, you can get your child vaccinated as early as 6 months, at least get that first dose in.
You know, I remember having been a child before some of this, and as a lung doctor, you read a lot about some of these earlier diseases. You do even more, of course. This was the disease that before vaccination was feared.
Yeah.
It wasn't something you wanted
Absolutely.
to have.
Yeah.
And here we are letting people and letting especially children have it, and it's also really deadly in adults. I mean, adults who get this, it is not a good ride.
Yeah, no, I think you're exactly right. And so many physicians now have never seen a case. So many pediatricians have never seen a case. We were just talking about my mentor, Dr. Hinthorn, a little while ago. You know, he is probably one of the last physicians around here who has seen a case and had to deal with measles itself. Measles is typically a clinical diagnosis. And it is just diagnosed by seeing it because, like you said, it was so common back then. We certainly have a recency bias and have the luxury of understanding that this vaccine, this very safe and effective vaccine, has been available for decades and has significantly reduced the number of cases, complications, and deaths from this disease.
Yeah, measles is good, vaccination is terrible.
Yeah.
No. You're not going to be happy with that choice or that decision.
We try to do no harm, and what I would say is that you are at risk of more harm getting this disease than you are of any harm with the vaccine at all. And we just want to promote healthy and safe practices to keep everyone healthy, because also there is a real life consequence and impact. Even if your child is sick and does well and recovers, that's great. But what about those days that maybe you have to stay home because you're having to watch the child, or you can't take your child to daycare because they have measles, or you have measles? Think about that economic impact and that loss in this time that it is so difficult for so many families. So that is one other issue, not only the health, but the economic impact as well.
Well said. Alexis Delstead is watching for questions from our community. Alexis, good morning.
Good morning. First, I want to thank Jeremiah. Jeremiah, thank you for sharing what it's like when storms are coming so the rest of us are educated on how this could affect someone or a child we know with asthma. Jeremy Yenser writes, this makes me feel less crazy. Every time it rains a lot, I feel like everyone around me starts sounding like they have the plague, and I can almost guarantee I'll immediately get a sinus infection. So my question is, this is from Jeremiah, how long after, or rather this is from Jeremy. Jeremy wants to know, how long after the rain stops does the shredded pollen floating around settle?
Team?
So pollen is heavy, it falls. So presumably for the next day, it might be in the air or so, but then it should go back to the baseline normal pollen.
On top of your car and everything else around your house.
Yes, that's right. But remember, it's still going to be a spring season. You're still going to have grass pollen blowing through the air. It just might not be as tiny. It might not be as fragmented and cause so much asthma.
The combination of wind, turbulence, rain, hail, whatever, all that all kind of makes it true, huh?
Yeah.
Okay. Alexis.
Marie has a question for Justin. She wants to know, what kind of conversations have you had with the teachers or the principal at Jeremiah's school so that they know what to look for when it's expected to be a stormy day?
Yeah, I think our school system is really great with having those conversations. Whenever we start the school year, we'll meet with our teachers and our nurses and let them know that he has a rescue inhaler in his backpacks with them for those cases if he needs it for any types of asthma-induced incidents at school. And they've given us a good open communication whenever he's needed to use it, just so that we're aware that we can provide that information to our doctor as well whenever he has any episodes at school. So we continue to have that communication with our teachers and our nurses and the admins at the school. So everyone's kind of involved around that information, and we'd be able to kind of just keep track if there's any other instances that happen throughout the day outside the home.
Johnny has a question for the doctors. Johnny asks, what's been the reaction in the rest of the allergy community on your research?
This is actually a known phenomenon. I'll let Dr. Merhab comment.
I think we had lots of excitement that we received from the community on our research. So we had the chance to present our research as an oral abstract at the American Academy of American College of Allergy, Asthma, and Immunology in Orlando back in November. And we had multiple media outlets reach out to us. People were very interested in our study. And I think the main reason behind it is because thunderstorm asthma is an international phenomenon, and it was very well recognized in international studies, especially in the Melbourne epidemic, where thousands of patients were rushed to the emergency departments within just hours after thunderstorms. And there were limited data in the United States, and especially Midwestern cities were underrepresented.
There were even some fatalities in that Australian study back in 2016 when they had this very large asthma exacerbation from a thunderstorm.
That's tough.
Yeah. There were 10 reported deaths at the time.
So I would tell patients, know they're coming, be prepared, like this family suggested, knowing when they're coming and maybe increasing your medication, or at the very least having your rescue medication available, is very important to make sure that everywhere that child is, everywhere you are, you have your rescue medication available. And if you know it's going to cause problems, maybe talk to your physician about increasing medication for your asthma around the time of a thunderstorm.
That's a pretty good. This has been a great discussion today, guys, and I think we've helped everybody. We're going to have to come back and talk about thunderstorm migraines, thunderstorm rheumatoid, thunderstorm, because there's a lot of other things that have thunderstorm kidney stones. There's a lot of stuff out there. You laugh. Let's just see. All right, we're going to roll through some final thoughts from our guests. Justin, let's start with you. And Jeremiah, if you have a final thought, you're on too, buddy.
I I'd say for me, I think it's just eye-opening of understanding that this is really just allergy related for us whenever storms are coming. So every time we're hearing that there's a storm coming, that we just need to be prepared and try to minimize any types of allergy-induced symptoms or asthma-induced symptoms as much as we can. And just knowing that it can potentially affect you for a couple days is really helpful for us. So we'd be able to understand, like, oh, if we need to go outside within a day or so after it rains, we need to make sure we're still heavily medicated so we can be prepared for any type of situations.
Awesome. Jeremiah, can I say thank you to you for being so brave and being on this show? Especially with Hawkeye, he's so mean. You just never know. All right. Final thoughts. Dr. Roran.
I think the main takeaway is awareness. It would be very helpful for clinicians to consider environmental triggers when discussing asthma action plans with their patients.
Yeah, absolutely true. I love asthma action plans. Very important.
And I think just watching the weather, paying attention to what's coming, being prepared, and maybe on those weather days, you are not standing outside on your porch watching that thunderstorm roll through. You're keeping your windows closed, maybe staying inside.
Oh, I love watching thunderstorms roll through. Hawkeye, final thoughts from you?
Yeah, no, I think it's good. With this case now in Kansas City, we are just trying to inform everybody, as we always do. There's no reason to panic. If you are vaccinated and immune to measles, there is no reason to have cause for concern for you or your loved ones. If you are unvaccinated, would still urge you to talk with your medical providers and please get vaccinated, at least get a starting dose to protect you and your family and the rest of the community around you as well.
All right, let's get back to Alexis to hear what she's working on for tomorrow's show.
Thank you, Dr. Seitz. Coming up tomorrow on All Things Heart, a hospital is the last place you'd expect to see a dance party, right? But that's exactly what this dedicated group of nurses created for this transplant patient. Christina Morales-Carrillo shares her journey from her heart transplant to the dance party and how she's doing today. That's tomorrow at 8 a.m.
That'll be an awesome dance. You know, I'm such a good dancer, Alexis.
Oh, we know you are.
No.
We have seen your moves at the company parties.
Yeah, no, it's most people wouldn't have called those moves. Okay, thanks for watching and listening today, folks. Hey, we had two shows in one because we got into the science in two areas, right? We had a great discussion about thunderstorm asthma, real deal, and we talked about how to handle that, and we had a great discussion about measles, also a real deal. And we also talked about how to handle that. As you make your decisions on whether it's asthma and a thunderstorm, most people wouldn't say, don't treat your asthma and run out and enjoy the thunderstorm and get wheezy and have more troubles breathing. Why would we choose then to ignore the science and to say, it's okay for myself or my children to have measles, even though they can be sterile, have brain damage, have lung damage, and the proportion of those is markedly higher than anything that's ever come from vaccination. That's why we talk about faith, hope, and science. Faith in each other, the hope that we can find ways to treat these diseases, and the science to take care of us all. We'll see you soon.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.